This recording is to demonstrate smooth muscle in the uterus and in the urinary bladder. First, the uterus. And this also included, this was a pregnant uterus, so the placenta is here because the placenta is embedded in the wall of the uterus. And so if you're curious about that, you can look up. We do not hold you responsible for the histology of placenta. But in the boxed-in area, as indicated here, you will see the smooth muscle. Now, when you study the organs, you will learn that the uterus has three layers. It has the perimetrium, which is the connective tissue, and in the mesothelium, a simple squamous epithelium that covers the uterus. And then you will see that it has a very thick layer of smooth muscle, which is pretty much all of this. And then it has an endometrium where the glands are, and during pregnancy that's where the placenta is formed and it's embedded in the wall of the uterus. So all we want you to do here, we're not holding you responsible for the histology of the uterus, because we're trying to get you to understand the basic tissues and how they function and how they're recognized in the histological specimen. So when you enlarge this, you're going to see smooth muscle cells, and this is a very nice area here where you can see the smooth muscle cells with the very long nuclei that when they contract they can actually become corkscrew shaped, because this nucleus doesn't change size, it just gets scrunched up upon contraction. And over here, these are they're cross sections, but they're slightly oblique. I think if so how do you tell the difference between a smooth muscle cell and a collagen fiber? Well, no collagen fiber ever has a nucleus embedded within its substance, within the collagen. So when you see nuclei embedded in an eosinophilic area or a mass, that should be cytoplasm, and most often it's going to be either cardiac muscle or smooth muscle. And it also can be cardiac muscle, but cardiac muscle cell shapes are different. They're not tapered, they're cylindrical, and skeletal muscle cells are not tapered, they're cylindrical. So on a longitudinal section, a smooth muscle cell is tapered at either end, and a skeletal muscle cell is like a rectangle on section, and so is a cardiac muscle cell, except for cardiac muscle cells are not pure rectangles because they have branching. Adjacent cells are connected together by branches. Okay, so I think maybe, I don't know, well, here are some lymphocytes that are in connective tissue between the masses. So I'll pause this a minute, see if I can find, maybe on the urinary bladder we even have better cross sections. Let's see what I can. Okay, here in this area you can see a pretty good example of what smooth muscle cells look in cross section and longitudinal section. You see here is a nucleus within a mass, and it's fairly round, and that and also one here, and another one here, another one here, and here, and here, and maybe here, and also here. So you have a cross-section of a nucleus within a mass, and if you compare that to the longitudinal sections over here, you can easily see the difference. So let's go to the urinary bladder. Okay, in the urinary bladder, and again, you're not responsible for identifying the urinary bladder. You are learning, and you can see an illustration of several things here. First of all, we've just given you, and I am going to correct this so it's not that large. So if we decrease this magnification, the lumen is bordered by transitional epithelium, and this is a very good example of transitional epithelium. The cells are dome-shaped, particularly when it's relaxed. If it's stretched, you're only going to have 2 or 3 layers, and they'll be pretty flat. And no stratified squamous, keratinized, or non-keratinized epithelium is ever down to 2 or 3 layers. So this is typical transitional epithelium. And then under here is fairly dense connective tissue with a lot of collagen fibers and fibroblasts, etc. But then where you want to look for the smooth muscle is out here. And I'm not going to belabor this. This is not as good example of the smooth muscle cells that you saw in the other specimen, which was the uterus. So you can look around and see the longitudinal sections, but it's not stained as well. I think the biggest advantage of this is to look at the transitional epithelium. And another example, like here are smooth muscle cells in bundles, and here they are in cross section. And actually the bladder is it has bands of smooth muscle around it, very much like if you know anything about how golf balls are constructed. It's like rubber bands, one layer of rubber bands after another. Well, that's the way the bladder is constructed. So when it contracts uniformly because the bladder is like a ball, and to squeeze the urine out. Okay, so this video has gone about 6 minutes, but I did cover 2 specimens.